Good. So this is the setup. I have a 3-inch tall foam roll under here. I have a 2-inch here below the knee. Prior to doing the setup, I evaluated mobility of both knees. She has more right-sided knee pain, and her right tibia is forward. However, I can take up the slack through that structure and get some spring, and it bounces right back, and if I did the test correct, there'll be a final recoil, much like this one, very similar. Okay, on this femur, I can take up the slack, and I can spring it, and I can feel the mobility go through that structure. I can feel it recoil, and on this one, it's very, very rigid. This one, I can't take up the slack with the same amount of force, and if I were to try to spring it, it would take a tremendously greater amount of force. And by palpation, I can feel that this is forward. And let me shut that timer off. Okay, so then we have this. The setup that I use is 3-inch foam there and a 2-inch here, and I'm going to push on that for 5 minutes. I'm on a bilateral scale, which is 0 now, and I can step on that. Alright, so then I can measure my weight. Okay, so we're at 195, 196. I can then push on her. So now I'm pushing through the femur in a AP direction, and you can see that it'll change slightly moment to moment. But on average, I'm putting 180 pounds, 179 pounds. Sorry, I weigh now 179 pounds because I'm unweighing my body by leaning onto that femur, and I'll stay on that 4 or 5 minutes, and the direction is fairly pure, anterior to posterior. So I'm putting an average of 15 to 20 pounds through it, and I can check throughout the duration to see how much force I'm putting. But I don't want to put much more because it's not necessary. And that is how I perform a A-P glide through the femur, and the goal is to restore terminal end range extension and feel springing through the femur. So we can stop filming here. Thanks.